I'm going to inform you on physician-assisted suicide as an option for terminal ill patients living in the U.S. Hopefully this will give you a better understanding on why physician-assisted suicide is considered in the first place. Imagine living with a terminal illness or disease that leaves you with chronic daily excruciating pain. What if this illness left you unable to clothe, feed, or even bathe yourself? Would you want to live life like that until the illness eventually took your life? What if you had the option to end your life when you was ready to do so? Would you want the right to ask your doctor to assist with ending your pain and suffering? Would that be unethical or immoral to ask that of your physician? Today I'm going to discuss the arguments that is for and against physician-assisted suicide and the process that takes place for ending a terminal ill patient's life. First, I'm going to explain what physician-assisted suicide is because it is often confused with the term euthanasia. Physician-assisted suicide is the voluntary termination of one's life by administration of a lethal substance with the direct or indirect assistance of a physician. Euthanasia is the act or practice of killing someone who is very sick or injured in order to prevent any more suffering. Physician-assisted suicide has been a hot topic debated among lawmakers in the U.S. for over 35 years. Advocates of assisted suicide laws believe that a mentally competent person who is suffering and has a short term to live should have the right to die if and when they choose. If a person has the right to refuse treatment to save their life, they should have the right to end their own life. On the opposite side, opponents say legalizing physician-assisted suicide devalue human life. Medical prognoses are not always accurate, meaning people who was told they would die soon could live for many months or years. Opponents state that people with terminal illness suffer from undiagnosed depression and they aren't competent to make an informed decision. Currently, only 4 states have a physician-assisted suicide type program, and they are Oregon, Washington, Vermont, and Montana. This is a board with additional pros and cons for physician-assisted suicide. There is a process that has to take place when someone with a terminal illness decides to end their life. Qualifications has to be met, and they are the patient must be 18 years old, live in a state that has physician-assisted suicide type programs, has a terminal disease that gives them 6 months or less to live, and they are able to make and communicate a clear-headed decision to the doctor. The first step is to make a formal request. A second formal request has to be made 15 days later, which should be oral. There has to be a written request signed by 2 witnesses before the doctor can prescribe lethal drugs. People who are considering assisted suicide should contact a patient advocate group for help with the paperwork and procedure. The advocate group can help screen out people that are ineligible, but the doctor makes the final decision. The doctor must inform the patient of alternatives such as hospice care, talking it over with family or the next of kin, and letting the patient know that it is okay to change their mind at any time. A second physician has to review the case and sign off of the first doctor diagnosis. 2 days after receiving a written request, a doctor can prescribe the lethal drugs but cannot, under no circumstances, administer them to the patient. Patients that are terminally ill face many challenges in how to live their last days. Some are willing to put on a brave face and deal with a slow death, while others wish for a faster and painless death. The debate will go back and forth about whether a dying individual has the right to die with the assistance of a physician. Some are against it for moral and religious reasons. Others are for it because of compassion and respect for the dying. There are multiple ethical reasons that are opposed to and for any physician-assisted suicide. Physician-assisted suicides will go far in maintaining the dignity of the patient and other ethical aspects as diagnosed in this speech. Thank you.